Hello, welcome back to Pretty Noir Health. This is our series on endocrine disorders. We are focusing on diabetes. Today, I wanted us to talk about the microvascular changes that occurs in the body and the macrovascular changes that occurs in the body as well with a patient that is diagnosed as diabetic. With the microvascular changes, this affect the capillaries. Those are the little vessels in the body. So you see things like diabetic retinopathy, which leads to blindness, vision changes, decreasing loss of vision. And sometimes, people will have those symptoms earlier on. Others would keep it on and not have it till like later in their disease process. Again, take home message, please ensure that you are not diabetic. Get your blood work done to rule out diabetes because we need our eyes, right? It's one of the senses. It is very important that our vision stays intact because without vision, there's really a lot of things that you'll be limited to doing. Another microvascular change is the peripheral neuropathy, which results from, demyelination of the axons. That's what causes like when you're sensitive to touch, when you can feel like a wound on your foot or under your heels, like you're sensitive to touch, those nerve fibers get destroyed. It's perfused as well when a patient is diabetic. Then it leads them to have like wounds that are not healing, and sometimes they actually have wounds and not even know that they have wounds. They show up at a primary care provider's office and they're doing a foot exam, and then they see that they have like a big wound there that's been there for God knows how long. That's as a result of the microvascular change that happens to diabetic patients. Another one is the diabetic nephropathy, which is affecting the kidneys. With diabetic patients, the condition known as microalbuminuria is when there's albumin in the urine, and it's also an indicator of renal dysfunction, and that is a result of the microvascular damage that results from being diabetic and being an uncontrolled diabetic. For macrovascular changes we see in diabetic patients would be strokes. They'll have a higher affinity for strokes and heart attacks, right? Those are affecting the big vessels. Big vessels, I mean like arteries and veins. They throw clots, they have atrophy in the heart, in the brain. Those are all complications that could result from being diabetic. Now, looking at your body at home for a patient that is diabetic and not know that they're diabetic, we have what we call acanthosis nigricans. It's like the dark black lines that appear like on the neck of people. They're usually obese. The elbows, the knees are like hyperpigmented. That's also a sort of sign that a patient could be diabetic and not know it. We also talk about that in the previous video, where you have increased thirst, which is a polydipsia, polyuria, and polyphagia. So you pee a lot and then you eat a lot. Those are all sort of signs that you can actually have as a patient that you report to a primary care provider, and we can like say, hey, that patient might be diabetic, would prompt, right, the A1C to be run, especially if the patient is not of screening age. For patients that are diabetic, again, it is very important that you take a hold of your disease. It is very important that you catch it sooner, because we go off, like I said, about the A1C. We have to treat it, bring it down low to a place where it does not affect all these organs that are listed in the circle. If you look at it, I have for the microvascular complications, there's glaucoma, there's cataracts, there's the diabetic retinopathy, there's peripheral vascular disease, which affects like the nerves. So there's no decreased sensation, poor wound healing, there's like pooling of fluid, like the vessel doesn't return fluid back, so they tend to pool blood down there and lead to like stasis, ulcers, and all horrible things, right? Make sure that you're watching, you're looking at your body, you're assessing your body at home. We talked about the heart attack, which is a microvascular change, the strokes, we talked about the peripheral neuropathy again, diabetic nephropathy, which affects the kidney. You're peeing out albumin in your urine. Please, the diabetic foot, it is important that if you know that you're diabetic or look at the soles of your foot. Make it a habit at the end of the day. Take off your shoes, take off your socks, and just look at the soles of your foot. Especially for people that are working for long days, long hours on their feet, make sure you assess your feet every day. It is important. Our health is our priority, right? There is no price tag to health. You never know how important your health is until you find yourself on a hospital bed, critically ill, fighting for your life. You have a chance to do the right thing now. Let's do the right thing. Again, thank you so much for watching. Please share, like, subscribe to my to my channel, I would really appreciate it. Again, it's Pretty Noir Health. If you have any questions, please leave them in the comment section. And again, thank you so much for all your support. I really appreciate it.